Hi, everybody. It's Dr. David with another episode of Your Health, Your Choice. Now, it's been a little while since we've talked about the various aspects of COVID and regulations and recommendations and my thoughts of where we are with this. But I thought that this was kind of an interesting time for us to kind of revisit some of those things because we had heard Dr. Fauci say that we are past the pandemic phase of the of COVID. I know he walked that back a little bit. There continues to be so much confusion. Let's face it, we've had confusion since day one of this pandemic, and so why should this be any different, right? But one thing it seems kind of obvious to me in looking at everything that's going on right now, it's almost as if the federal government and the recommendations being put forth has moved into the your health, your choice phase based upon the both not just the conflicting recommendations, but even the changes of the wording of what's being said, options that are being put forth, etc. So it really has kind of moved into a little bit more of a choice thing. Even words such as recommendation is being used. We don't really hear much about mandates anymore. So I want to go over some of the different aspects of these kind of, go through them. I'm going to tell you my opinion about each of these as we go along the way too. Of course, this is just my opinion as somebody who has been a frontline fighter against COVID, as well as somebody who's taken natural approaches and who, of course, respects medical choice of people to the autonomy for a person, for a family to make their own decisions based upon their personal situation. And of course, my goal is also to help support as many people as possible, but more importantly, to educate people so that they are able to have the most up-to-date information, or maybe just to see things from a different point of view. Okay, so we're going to go over. So first of all, this is an interesting introduction that was actually found on the CDC page. Okay. And again, I'm glad to hear this type of wording being done and acknowledging that we don't know everything, because so often we recognize doctors, government officials, they talk with such certainty as if people know. And one thing that we've all kind of learned is that nobody really knows squat in terms of being able to predict too much of the future. Now, certainly if you follow what we've been talking about, the good people such as Dr. John Campbell, who we've referenced multiple times here, yes, a lot of us have the ability to kind of foresee where things are going and have been able to make early predictions. But I think we've all had mistakes along the way. The one biggest mistake that I would probably say is I certainly did not predict a long hauler coming. Perhaps I should have, because of my knowledge about PANS, the pediatric autoimmune neurodevelopmental disorder that was first seen as PANDAS, followed by into more PANS when we realized it wasn't just strep. But I've, certainly come to look at, especially in children, long COVID is just another form of PANS, in my opinion, and basically in adults, it's just an adult form of that. So, hey, so we kind of were talking in the right language, but I didn't see this coming. All right, so here we go. So first of all, let's talk about masks. That was kind of probably the biggest change that happened on a federal level, especially related to airline travel. Okay, so I'm sure you heard, made big news all over the place, where a federal judge back on the 18th of April overturned the mask mandate, if you will, quote overturned, for airline travel. And this is what it now says on the top of the CDC webpage. As a result of court order, effective immediately as of April 18th, 2022, the CDC's January 29th, 2021 order requiring masks on public transportation conveyances and at transportation hubs, i.e. airports, are no longer in effect. Therefore, the CDC will not enforce the order. The CDC continues to recommend that people wear masks in indoor public transportation settings at this time, and that the page will be updated soon to provide additional information. So what does that sound like to you and me? Your health, your choice. Hey, look what we found there, right? Okay. Now, of course, everything gets a little bit more complicated because you probably have also heard that the Justice Department, on behalf of the administration, is appealing this, but also they did not ask for an emergency pause on this decision. So that was something that they could have said, that everybody was in such grave danger that it was in the national concern for them to be put on pause, and that's not what they did. So that kind of is a little reading between the lines here, that they obviously don't think it's that important of a thing, or they would have gone forward with it and really done that level of an appeal. So that's kind of interesting as well. Now, something that happened on that day, which really did kind of bother me, though, okay, because the travel industry, mid-flight for some people, declared that this mandate was over. And of course, there was big fanfare from a lot of people on planes. We've probably seen video of that. But I had a problem with that, in that, there were people on that plane, potentially people immunocompromised, people who didn't have good defenses, who may be exposed to somebody when they get off of the plane and staying with somebody. And it seemed to me that there was kind of like a social contract, that people, when they bought tickets and when they got on that plane, it was under the understanding of one thing: being masked. Now, you can agree with the mask, disagree with the mask. That's not what I'm talking about. I'm saying people got on those planes thinking that they were going to have what they felt was a level of protection that turned out mid-flight not to happen. So, yeah, why they made this call mid-flight, why they didn't do it at 3:00 in the morning so that I'd be known for the next day, but mid-flight, that I know that caused a lot of consternation for some people, and I just don't think that that's the way to treat people fairly. When people, if you agree to something, at least make sure that, if they would have said, hey, starting tomorrow, if you don't want, we'll give you a refund, we'll do whatever, that would have been fine. So I realize that that's happened. That's not going to change. That's not going to change what happens going forward. But I just thought that was in pretty poor taste that they would do that to people. Well, again, whether you agree with it or not, but still, those were those people's lives. And imagine if you were sitting on a plane really concerned about it, and all of a sudden you saw all these people not just ripping their masks off, but screaming hooray about it. More screaming, of course, is more passage of viral infections through respiratory droplets and aerosols. We know that from the very beginning. So anyways, I've said my piece about that, but gosh, I think that could have been handled slightly better. Okay. Now, but what is the reality now going forward? Well, I think the best way of looking at this is that if you're a concerned passenger, again, whether it's because of yourself or who you might expose to, by far the best thing to do is to wear a KN95, N95, or similar type of mask, properly fitted. Again, how often do you see somebody that has a mask on that you see space around it? Right? But if you want to be protected, you should have a close to harmonically sealed mask, at least around the edges, because that's going to be the thing that's going to let the least amount of unfiltered air, using the mask as a filter, into your body. So, realistically speaking, it would have been interesting to know, well, what if we would have done something like that from the very beginning? The people who wanted to be protected, the most vulnerable, had a level of protection. Of course, that didn't happen at all. We were even told, don't use N95s and K95s, save it for the doctor. At the moment that had started, that was a good idea, right? They told us to put cloth masks on, which of course we later found out, especially during Omicron, was not much more than facial dressing, costuming, if you will. But there's still a lot to be said for these more advanced types of masks. And I do believe that they do provide a significant amount of protection for the person who wants it. Okay. Now let's talk now about vaccinations, and I realize that there are certain areas of the government, people work for government, people who in the military, who there is a true mandate. But that is the only government mandate that exists. Everything else from the CDC has always been a recommendation. Nobody was being hunted down to give them a vaccine against their will, being held down to do so or anything like that. Of course, they made things very difficult for people, and certainly in different locations, California, New York especially, and some of the other places around them, certainly did have local mandates, state mandates. Some of them, of course, from the beginning, we thought were just totally ridiculous, such as you had to wear a mask outside if there was nobody around you. I mean, come on, I think we all kind of saw that as ridiculous from the get-go. But yet there were people who were absolutely living under those circumstances for a while. So, but of course, what is a benefit that people have from vaccines? It is protecting those vulnerable that are around you. It's protecting yourself if you're concerned about it. Now, of course, lots of good conversations to be had is how effective is the vaccine at all now that we're dealing with Omicron, when the vaccine was specifically built not against Omicron, but against the original Wuhan strain, against, the alpha, beta, deltas, etc. And it's a very fair question I think that we could be asking right now is, considering the level of protection that the vaccine gives, it's just not the same level. It does provide some. We know multiple studies continue to show that severe disease, hospitalization significantly reduced. We also know that against asymptomatic and mildly symptomatic, not nearly as much though. So those are fair types of questions. And that's obviously for people who have no level of protection whatsoever. But of course, we now know that natural immunity, which many of us were saying for a long time, but of course, we do have government recognition that wild natural infection is a thing. So I'm glad that we're making those types of changes as well, which of course is part of the recommendations, but also the Your Health, Your Choice, because people are now better able to assess what their own risk is, as well as what the risk to them could be for other people. All right. But now I'm going to go a little bit into what the recommendations are from the CDC. Again, I know that there are people out there listening to this who do not recommend it, who will not trust anything that the CDC does. And let's face it, there were certain things that have happened during the pandemic and way before the pandemic that I think can call into the crystal clear trust in the CDC. Although I do believe that they get it right more often than they get it wrong. But, let's face it, who amongst us could have predicted everything, as we talked about a minute ago? Okay, so this is what they're saying, and I'm gonna have to read this because it is a little detailed. Okay, so first of all, this question is, when are you considered up to date on vaccines in the first place? Okay, so you are considered up to date with the vaccines if you have received all doses in the primary series and a booster when eligible. When is eligible? 5 months after the first vaccine. Can people have a third dose or even a fourth dose before that? Yes, an immuno-incompetent person, a person who is susceptible, could have gotten even from where they're calling it a third dose as opposed to a booster dose. That was way before the boosters were actually listed as boosters. So of course there is that. And what they say is but getting a second booster is not considered necessary, but to be considered up to date. But if you've had 2 doses and you haven't had 5 months pass before booster, you are still considered up to date by whatever you're graced with the ability to be somewhere, do whatever to be up to date. That's what gets you there. Okay. Now, of course, the recommendations are also differing depending on your age, your health status, what vaccine you first received, because if you had received just one of the Johnson & Johnsons, then just one of the messenger RNAs is considered a booster shot as well. But where they're really talking about with age is relative to adults over the age of 50. And now, as you probably know, those who are eligible, who can receive a second booster if you're over the age of 50. Okay. And of course, and if there's been at least 4 months after the booster. Okay. Again, people will follow that. They can choose to, they cannot to. This is recommendations from the CDC, but now you have the information there. Now, there's another very in particular type of thing, and this is something that I made a video on about a month ago, which is that, what if you've had Omicron? How do you know you had Omicron? Well, if you tested positive for COVID, and it was from at least the early to mid part of December onward, you had Omicron. By that point, it was 98%. Odds are you certainly had Omicron if you tested positive. Now, granted, there are people who didn't test. We don't know. Granted, the people who tested say, yeah, but I lost my sense of smell. I lost of taste. Every symptom was there right now of what I think is long COVID. Okay, you probably had Omicron too. Again, depending on when the infection happened. Now, this is where it gets also interesting, because what the CDC official statement is not what the statement from the CDC director, Dr. Walensky, had said. So here's what they say. They said the CDC says you should get a COVID-19 vaccine booster even if you've already had COVID-19. No current available test can reliably determine if you are protected after being infected with the virus that caused COVID-19. You'll notice here that they do not differentiate at all whether you've had 1 dose, 2 doses, 3 doses. They're saying even if you've had COVID. We'll get into that in a little bit. They then say people who had 2 doses of the messenger RNA series plus 1 of a booster do not need a second booster if they recently were affected by the Omicron variant of the coronavirus. That's what Dr. Walensky said. Okay, so here we have the director saying one thing, where the official statement from the CDC is something else. Why would we be confused? Who knows, right? Just because the person who runs the agency is kind of saying something different. So that's just okay. But I think she's right. I think that if you've had a booster and if you've had the 2 doses and you've had Omicron, how much more protected could you possibly be right now, right? I would argue that if you had 2 doses of the vaccine, or if you had a previous case of COVID, and you had Omicron, you're as protected as you probably could be right now as well. That's not what the CDC is saying. That's me as a private individual who knows a lot about this stuff and who's been studying this stuff from the very beginning. That's where my take is. That's where I am finding myself to be different from what the CDC formal recommendations are for this. But let's face it, if you've had one, and you may have heard me talk about, what's the almost defining it as how many times have you been exposed to spike protein? Right? The more times you've been exposed to spike protein, regardless of whether you got it from a vaccine or whether you got it from the disease, you have multiple exposures meaning you have long-term memory. Granted, if you've had Omicron, the B cells, the T cells, the antibodies are specific against those mutations that have happened that when Omicron came around to be. And when we hear about the BA1 and the BA2 and the BA1121 and all those things, I don't think that was actually one, but you get the idea. They're all Omicron. If you've had Omicron, you should be well protected against other Omicron. Will there be another variant who comes along? Well, we don't have any evidence that it won't, right? I mean, God willing, Omicron will stick around and maybe we'll just get this Omicron 3.2.1 and we'll just keep on getting subvariants of the Omicron. But as long as we are staying in the Omicron world, that's my belief. If you've had Omicron already, especially if you've had at least one other prior exposure to spike protein, I'm thinking that you have to be pretty well protected, excuse me. But there's another point to this as well, which again, they're not taking into account. If you've had any form of COVID, you do have those antibodies, right? And we have seen, and against Omicron especially, but what else have we seen? Lots of studies are now showing that longer-term protection by wild virus is better than vaccinated. Okay, that doesn't, so that doesn't mean a person should go out to catch COVID just so that they have immunity. Although we certainly know of people who chose to do that, your health, your choice, I guess. But, this is a hindsight type of thing. But realistically, if you have had Omicron, one other thing. You know how you did with it, right? So when you had Omicron the first time, then however sick you got, you now have antibodies for it. We actually know that the sicker that you got, that's another thing, that you have stronger antibody protection against it. So the people who are asymptomatic are not as protected as people who are more sick, even if they weren't hospitalized. But most people have had a flu-like illness for sure. So that's another thing. You now have protection if you had the disease that you didn't have before, and you saw how you did with the infection, and it would be really, really difficult unless it was a significant life change. You started chemo, God forbid, immunosuppressive therapies, that you would have a worst case of a re-exposure, because you can certainly get re-exposed to Omicron. There are people who get second one, but in terms of the severity, the likelihood of you having a severity once you have immunity when you didn't have immunity before, come on, that's just logic and understanding of really kind of basic immunology. Okay, so that is kind of what my take is on that. All right, now here we go into the testing. Now, things have also gotten confusing because of a your health, your choice aspect in the fact that the government is now sending out millions and millions of home tests. Okay, well, that's good. It's nice enough to go somewhere. It's nice enough to pay for something. Yeah, taxpayer dollars are going for something, right? But because of the fact that people aren't going to doctors or labs to get tested, all of those home tests, they're not being recorded as positive or negative tests. So any numbers that we are seeing relative to the number of cases, obviously deaths we know about, but the number or hospitalizations we know about, that doesn't mean people hospitalized due to COVID versus people hospitalized and who happen to have COVID. But those types of numbers can be much more sussed out. But how much COVID is there out in the community right now? Nobody really has any idea whatsoever. We know that the numbers are up. Okay. Thankfully, though, the death numbers are down. The hospitalization numbers are down, even though, and that's been one of the surprising things also. If you look at what happened in Europe, in England in particular, there was with the Omicron BA2, excuse me, there was quite a big spike that went up. And even in terms of some of the hospitalizations, we haven't seen that in America. We've seen some increases of mild cases, but we have not seen the increase in hospitalizations that we saw elsewhere. Okay, so this is now what the CDC is saying. Okay, so again, from my perspective, also remember, a positive test is almost certainly a real thing. A rapid negative, especially that's negative, there's false negatives out there. So my trust in a positive rapid test, quite good. My trust in a negative rapid test, not so good. But even with the PCRs, I would say a little bit better. Obviously, collection is really important. Someone who's doing one of those things real quickly, doesn't get up the nose, versus people who get back further, does a lot of rubbing around where you point you're uncomfortable, the more likely you're going to pick something up relative to what a person's viral load is. Hey, viral load, that's a term we haven't introduced yet today. But this is what they're saying. If you've had COVID in the last 90 days and recovered, you do not need to be tested if you've been exposed unless you develop new symptoms. So that's something that's a little different. Before they were saying if you've been exposed, test, quarantine, no matter what. And if you remember, the definition of an exposure is significant, close room, closer quarters type of exposure for more than 15 minutes, right? So being outside, or if you're just passing by somebody in the wind, that doesn't count as exposure. Okay. Now, what they do say, though, is if you do develop new symptoms, which I agree with this, test immediately. If a rapid test is negative, I would say get a PCR test if you really want to know for sure that you are okay or not okay in terms of, for your own self, if you are an at-risk person that's maybe thinking about if there's a monoclonal antibody out there that's available that's specific for that subvariant, or Paxlovid or some of the other medications that people are taking. That would be a good thing to know if you really did have it or not, right? Um, so, but again, I would do a PCR test just to confirm. Okay. Now, what they do say is to stay home until you know the test. Then, if you're going to be around others in the family, to wear the well-fitted mask like we talked about before. Now, in terms of the when to get tested, so they put a little bit of a little flow sheet together. So, step one: do you have COVID-19 symptoms? Yes. Kind of as we said before, get tested immediately and follow the quarantine guidelines while waiting. We'll get to that in just a second. Step two: have you had close contact with somebody who has COVID? Yes. Then they say that if you're not symptomatic, get tested 5 days after exposure and then follow the quarantine guidelines. If you have not then you do not need to test. Pardon me. There are then some circumstances that say, hey, a person should get tested. So this is not for everybody under certain circumstances. People are traveling outside the United States. First of all travel, you have to go by where you're traveling to, right? So if a place says you must be tested positive, or you must be vaccinated, or you're not going to be able to do anything but stay in quarantine for a period of time once you land, of course, that's where that place is. That's what you got to go by. But if you're not up to date with vaccines, they do also a lot of for outside the U.S. They say get tested as close as you can before your departure, before the trip, no more than 3 days, just so that you don't end up on a plane, getting other people sick. If you're traveling to the United States from outside the country, over 2 years old, before boarding, must show a negative COVID test taken no more than 1 day before travel, or documentation of recovery in the 90 days. Okay, that's kind of nice, that whole 90 days. Natural immunity, while it's herd immunity, that's kind of what they were, again, acknowledging that, which is great. And then they do say all travelers to get tested 3 to 5 days after arriving in the United States. So just again, if you brought something in, caught it on the plane, you can at least know in terms of passing along, because if you're in those areas, you may be more at risk for having caught it. Okay, within the United States, they do say follow all state, tribal, local, and other territorial health recommendations that relative to where you are going to, right? And they say that if you're not up to date with the vaccine, get tested at closer to the time of departure, but not more than 3 days before. And then they also say 3 to 5 days after you travel. Okay, cruise ships do have their own guidelines. I'm not going to get into them today. Looking forward to see what the guidelines are when, God willing, we are able to take our family cruise in July. Okay, last thing to talk about is quarantining. Okay, yay, we all loved being locked down before, didn't we? But this is obviously much more specific to the people who have had exposure or who are sick. Okay, if you had close contact with somebody with COVID-19 and you are in one of the following groups, you do not need to quarantine. Number one, if you're up to date with your vaccines. If you've had confirmed COVID in the last 90 days, which meaning positive COVID testing, not just I think I had it. And then also they said, if you're fully vaccinated, you don't need to be quarantined for the first 5 days after the exposure. But they do say to mask for 10 days unless you develop symptoms. If you develop symptoms, of course, test immediately. But they then say after the 5 days, then test. If you're not fully vaccinated, then quarantine the first 5 days, mask 5 days, even if no symptoms in cases in case you are asymptomatic, but you could be contagious for up to 10 days after. Okay. I don't know about you, but that also seems like a lot of ifs, ands, or buts. But I guess when you're looking at it that perspective, these are recommendations. So people are going to do what they think is right. But at least you now know what the Centers for Disease Control is saying in terms of like how to go through these landmines of everything. So leave comments down below. Again, you can agree or you can disagree. I'm just kind of saying what the facts are in my opinions here. If you disagree with my opinions, feel free to share that as well. Also put out again our plea that if you're not a subscriber to this channel, please do so. Hit that notification button so you know that when videos such as this are being put forth. And of course, another plug, please join us on our Patreon page. If you like what you're hearing, if you want to support this channel and support what I do, please become a Patreon member. All right. Thank you so much. Hope everybody has a great day. Bye-bye.